Are these veins necessary?
As I mentioned, 90% of the blood flow that returns to our heart goes through the deep system. And when we remove superficial veins, we eliminate veins that are pooling blood. So when we stand up in the day, these veins will fill up and won't empty till we lay down at night. So, in fact, by removing them, we improve your circulation. The blood flow that gets in gets out normally through other pathways, and there's no pooling, no achiness or fatigue.
And so tell me, how do you treat them?
Years ago, the standard for treating varicose veins was called a vein stripping. A vein stripping usually required general anesthesia to be hospitalized for a period of time and was a much more invasive procedure. The standard today that has replaced vein stripping is to use heat ablation of the great saphenous vein or the small saphenous vein. These are superficial trunks that feed the varicose veins. So when we use heat ablation, we might use laser ablation. That's what I most commonly use. And lasers can be used within the vein just through a needle puncture to seal that vein closed to eliminate the leaky incompetent valves that feed the pressure to the varicose veins. And then we have to deal with the varicose veins as well. If you seal the pressure that feeds them, they will soften and become smaller, but they will not totally go away in most cases. So they need to be addressed also, sometimes with sclerotherapy, an injection of the vein with a sclerosant to close it, or sometimes with very tiny little incisions, a procedure called a microflebectomy, where we numb up along the vein through tiny little incisions, remove the veins and these clusters of veins so that the leg is nice and smooth.
And so this is actually done all in the office?
This is always an office procedure. People drive in, walk out, and drive home. And the recovery is rapid. Typically, people who are working might have a procedure done on Friday, and by Monday they're back at work. I've had people return to work the next day. I've had people play golf the next day.
Wow.
There is a downtime. There's always healing time, even with minimally invasive procedures. And the downtime is often 7 to 10 days before you're totally over it, but you're rapidly recovering as soon as the procedure's done. And the procedure is almost painless. People are always anxious before they have a procedure, but once they get started on the procedure, they realize that there's nothing to worry about, it's not painful, and you're comfortable through the whole procedure.
So truly, this is revolutionary when you're talking about treating varicose veins.
It has dramatically changed how we treat them, and because of the dramatic changes in the treatment, many more patients now have varicose veins treated. It's a very common disorder, probably the most common disorder that vascular surgeons see. And until the newer developments with vein treatments, most people just put up with the symptoms and the discomfort. Now, treatment is a medical indication. Of course, the bonus is also the cosmetic improvement.
That they look so much nicer.
Sure.
All right. Well, thank you so much for all of this great information, and I hope that you have enjoyed.
Thank you.
On the internet.
Over 9% of our population. The diabetic patient is at a higher risk of Dr. Adam Katz. Dr. Katz is a board-certified ophthalmologist and fellowship-trained retina